On Thursday morning, April the 29th, I went into one of the major teaching institutions in the Boston area to go to work as a physician. By that afternoon, I was in a lockdown on a psych ward in a paper robe, no other clothing. I had been placed on suicide precautions. I was looking out of a window that had bars and screen on it, wondering how I'd gotten there. By my final days of using, I had built this habit to a point of using a drug called sufentanil. It's a very powerful narcotic where one 5 cc ampule can be used to do an entire open heart procedure. I was injecting 10 ampules a day just to feel okay. I wasn't getting high, there was no fun in it, there was nothing in it except the avoidance of feeling horrible if I didn't have it.
And it wasn't until I had lost my profession, lost my self-respect, was on the verge of killing myself, that I finally, beaten down, and we call it the gift, being given the gift of desperation, being beaten down like that, I finally said, I can't do this. I can make it through medical school. I can get an A in organic chemistry. I have unbelievable discipline. I have incredible self-control. I cannot beat this. At that moment, I was ready to be okay. And I just needed somebody to tell me what to do.
Physicians are not immune from health problems. Indeed, 1 physician out of 10 will face a life-threatening illness during his or her career. Among the most serious threats to physician health are alcoholism and dependence on other substances. Physicians sometimes suffer from emotional or physical illnesses as well. Without proper treatment, these conditions can jeopardize health and well-being, disrupt families, and ruin careers.
The work of Physician Health Services actually began over 20 years ago when a group of concerned physicians got together to try to help colleagues that were suffering from drug and alcohol dependence. Apparently at the time, what they were seeing were physicians that were having difficulties with substance abuse and were being administratively adjudicated by the Board of Registration in Medicine, but no help was actually given to them. So they got together to try to provide counseling and support for these physicians, started peer support groups, and began a monitoring contract to help guide and monitor the recovery of their colleagues. The work of this group over the next 17 years provided the foundation for what is now Physician Health Services. Established in 1993 by the Massachusetts Medical Society, Physician Health Services is a non-profit corporation designed to educate and aid in the prevention of physician impairment. We originally began with 1 physician and an administrative assistant, but rapidly the numbers of referrals grew and the sophistication of monitoring increased to the point where we needed other physicians to help us. That was an important turning point for PHS because we became a separate corporation so that we could accept charitable donations. At the same time, the Medical Society sponsored legislation which was later signed into law that conferred peer review protection, that is, complete confidentiality upon the work of PHS. As you can imagine, that is the cornerstone of our work, because without it, physicians could not come forward in confidence, knowing that what they say, either telephonically, face-to-face, or through writing, would be protected in terms of confidentiality.
Since 1993, when PHS became incorporated, we have been receiving funding from the Massachusetts Medical Society and from the malpractice insurance carriers in the state. We feel very fortunate that the malpractice insurance carriers have recognized the importance of the service we provide to physicians. PHS was able to use these increased funds to contract with 5 physician associate directors at PHS. They are located in disparate areas of the state: North Shore, South Shore, Boston area, Worcester, as well as Western Massachusetts. With their assistance, outreach efforts have increased dramatically. PHS routinely presents educational lectures at hospital grand rounds, medical schools, and healthcare organizations. As a result, the number of referrals have increased 3-fold. PHS provides outreach, intervention, support, and monitoring to physicians with health problems. The support we provide includes assistance for physicians with behavioral health concerns, mental health issues, and substance abuse. We also serve as a resource for physicians with physical illness gambling issues, and domestic violence. Traditionally, PHS has been viewed as a vehicle for treating physicians with substance abuse or dependence problems. In today's ever-changing and competitive practice environment, physicians are also vulnerable to mental health issues, for example, depression or other mood disorders, as well as behavioral problems, such as a doctor's inability to get along with others and communicate effectively with peers and patients. Other problems affecting their ability to practice include stress, despair over changes in the practice environment, family difficulties, and emotional problems. To help meet these challenges, PHS has created a behavioral health monitoring plan in addition to its chemical dependency monitoring contract. We believe this contract will assist a larger number of physicians who are in need of a wider range of support. PHS remains committed to assisting physicians with learning how to balance their own lives and take care of themselves and their families in order to effectively take care of their patients. We are available to any Massachusetts physician, resident, medical student, group practice, HMO network, or hospital.
About 25 years ago, when I got into healthcare, I held a stereotype of physicians that I think many people do still in society today. Basically, I thought they were invincible. I didn't think that they really faced the same challenges that we did. I certainly didn't think that they suffered from many of the disorders that faced the population at large: emotional issues, psychiatric disorders, substance abuse. Well, during the past 15 years, as a CEO of a health system, I have found out differently. Physicians are a lot like the rest of us. And they, as colleagues of ours, oftentimes are in need of our help. Several years ago at the Cambridge Hospital, we turned to the Physician Health Services to give us some assistance in putting a mechanism in place to help our physician colleagues out when they faced many of these challenges. It was enormously helpful to us at that time. More recently, when the Joint Commission passed new regulations, it became clear to us that we in fact needed a more robust mechanism to identify physicians in need and also to manage some of these issues. We're now in the process of establishing a reconstituted medical peer review committee, and we're working with the Physician Health Services to not only put a mechanism in place where we can safely identify and protect the confidentiality of our physicians, but also to get them help. We're deeply indebted to the Physician Health Services, and I would encourage all of my colleagues in the hospital and the health system side, as we look at the new requirements, and more importantly, on behalf of our patients and our physician colleagues. If you need some help, if you need to put a medical peer review committee structure in place, or if not, because Physician Health Services will come up with several different alternatives to help you with these issues. It's worked for us, and I think it'll work for you.
As an associate director, the toughest case for me personally to be involved with is the one that doesn't reach Physician Health Service. It's the one where people have been concerned about a physician, but because they like him, they're worried about his career, they don't want to cause any problems, they don't say anything. Because sometimes, in that kind of a case, the physician dies before anything can be done. A young physician, married physician, died of a drug overdose that was probably accidental. And in looking at the circumstances afterwards, everyone had his best interest at heart. But the people who realized something was wrong didn't feel like they could come forward. Maybe they didn't know that there was a program, a state program like Physician Health, that could have possibly helped him.
Many physicians cannot confront their own health problems. Instead, they deny their symptoms out of a sense of omnipotence, and they make recovery that much more difficult. Similarly, many physicians who know a colleague is ill fear they'll betray a friendship or are unaware of the available resources to help.
Physicians find it very hard to admit that they're sick with anything, whether it's a chemical dependency, mental illness, or even a physical illness for that matter. We somehow have the idea, some of us, that because we work in this field, we're never going to be touched by any of the illnesses we take care of, whether it be cancer or depression. And in order to work as a physician, many of us have to become somewhat grandiose and with the feeling that we can take care of other people no matter what, which we can't exactly, but that's a feeling that many of us have.
There is this tendency, perhaps, for people who are entrusted with the lives of others to develop a God complex, and there are a lot of good jokes and bad jokes about that tendency, and I think it's a good example of how humbling a disease or disorder, addictive illness, is, in that it brings most anybody to their knees when they've been hooked.
M-deity is the phrase that we learned so early on. Aspects of medical education and training is not so much an aspect of the disease as a hindrance to getting the appropriate kind of help. When you need some kind of spiritual strength, and the only God you've ever had to deal with is you, and you look in the mirror and you see how badly flawed this God is, it's very, very difficult to ask for help from somebody else.
Also, the public wants us to know everything. They want us to be perfect. They don't want us to have a cold. They don't want us to have had a fight with your husband. They want you there and perfect at all times. So the combination of what the individual physician feels and what public puts on them makes us feel like there's no way we can do anything wrong or ever be sick. And it's very, very hard for us to come off of that pedestal, no matter who put us there, and admit that we're just as human as anybody else.
Many physicians began abusing substances as students. The academic burdens that face medical students are often coupled with a lack of time to participate in health-promoting activities. With no time to socialize, students may begin to feel alienated and alone. Compound these stresses with the realities of the medical profession, and the emotional and physical toll can be devastating.
I spent my senior year in high school and my 4 years of college really catching up to my peers who had begun earlier. It was very soon an everyday thing. I studied hard, I worked hard, and I played very hard, and that included drugs and alcohol. It was really December of 1992 where the story began to change drastically. I was, as an anesthesia resident, doing a rotation in the cardiac surgical service. On one afternoon, I came upon a plastic bag with 2 ampules of sufentanil in it. They were not my ampules that I'd checked out for my cases that day. They had been checked out by someone else from the pharmacy. I don't know what my exact thoughts were that day when I decided to keep those, but I took them home. At some point, I decided that it was going to be okay to inject a little bit of that sufentanil. I knew how potent it was. I'd seen what it had done to my patients. It created a pain-free state, and there was something inside of me that wanted to be pain-free for a while. And by January of 1993, I was using sufentanil every day just to feel okay. On Sunday, April the 19th, there was an intervention consisting of my department chairman, the vice chairman, the 2 chief residents, and my now ex-wife, who all confronted me that something was wrong. We think you're using drugs. We think you're very, very sick, and you've got to get help right away. What I know about addiction today is that there was really no difference between me and the person in the street. I had access to a different drug. I had access to better supplies, different supplies. But the way I saw the world and felt around using that drug was exactly the same.
Referral to physician health service comes from colleagues, nurses, family members, friends, and in many cases, the physicians themselves. Each referral is treated in a confidential and compassionate manner. PHS responds to the concerns of families, colleagues, and hospitals by providing coordinated interventions and referrals for treatment. Although participation with physician health services is voluntary, we will strongly urge a physician who is ill to get help. Like anyone else, a physician who avoids treatment for substance abuse, alcoholism, or mental illness flirts with death. They risk their lives and those of their patients. Willingness to face up to one's own problem or the courage to act on concerns about a colleague leads to recovery before a physician's skills and medical practice are compromised.
Let me just back up a couple of days to the first time that I ever met the Director of Physician Health Services. I had been referred to him by my department chairman and was told that if I didn't show up at Physician Health Services and sign a contract that I would not ever return to work. He tried as best he could to confront the issue. It was during that time that I felt so threatened by his, what appeared to me at that time to be very intimate knowledge of something I'd worked very hard to keep very secret. Everything that I had kept secret was now out, known to a lot of people. And quite honestly, it was as good as I've ever felt. It was a blessing. I mean, it was the best thing that ever happened. Probably for the reason of getting rid of the burden of those secrets. I had consequences for that. I had wreckage from the past for that. But you know what? Despite going through a divorce, despite being unemployed, and at that time unemployable, completely uncertain about my future, I'd never felt better. I think that for people sick and suffering with the disease, that their ability to hear is the issue. I would say that there are a couple of things that if you have the ability to think them or to look in the mirror and see them are definite signs of problems. And that if you have it in you, if the disease has not taken you so far yet, that help is available and to reach out. I would tell them that the things that they fear losing the most by not seeking help, by keeping it to themselves, by keeping the secrets, are the exact things that they're going to lose by not asking for help. Confronting certain feelings early in recovery is very important. For me, shame and guilt were powerful. I was not a bad person trying to get good. I was a sick person trying to get well. That was probably one of the most single, powerful concepts that I had ever been introduced to. To have lost a career and a home and a marriage, a family, all to the disease of addiction, and with no promise, no suggestion even, of being able to recover any of it. To see today back practicing medicine the way I want to practice it, the place I want to practice, that's okay, that's good, I have a job. But what I've really recovered is a sense of who I am outside of medicine. The number one priority in my life today is getting my head on my pillow tonight without picking up a drink or a drug. If I can accomplish that, then I have a chance at continuing to contribute to the people and the places around me. I have a chance to raise the children. I have a chance to be a good husband. I have the chance, the privilege of being a good son and a brother, and those are all gifts given as a result of me staying away from the drink and the drug. Today, my life is full of choices and full of decisions, all as a result of changing the person I brought into recovery. Certainly, I see things today that department chairman, that vice chairman, that those two chief residents who were courageous enough to set in the face of threats of violence, of lunatics screaming at the top of his voice, but they were able to, with courage, stay in there. I don't know what drove them to that, some caring for me that I was able to build in spite of the disease. Addicts are good at that, surrounding ourselves with people who enable us or facilitate us or care about us. But they were able to do that, and that's what Physician Health Service is about. They're about providing the venue of courage, the place to go when no one else can go there. And they have with them people who have been there, who have been in the dark and can go there and find someone.
Massachusetts law requires healthcare providers to report to the Board of Registration in Medicine if there's a reasonable basis to believe that a physician is practicing while impaired by alcohol, drugs, physical disability, or mental instability. Reports are also required if there's a reasonable basis to believe that a physician is habitually drunk or a habitual user of drugs. That's the law. But according to the board's regulations, if a physician with a drug or alcohol problem agrees to participate with a board-approved program, such as Physician Health Service, and there are no allegations of patient harm, and the reporter receives confirmation from us within 30 days that the physician is in compliance with our program, then the reporter is not required to file a report with the Board of Registration in Medicine. Communications with PHS is protected under state law, and chemical dependency cases have additional protections under federal law. The road to recovery begins with awareness and intervention. But what happens next?
There are two general monitoring contracts that are offered to physicians by Physician Health Services: the Chemical Dependency Contract and the Behavioral Health Contract. Both of these contracts involve an initial evaluation and intake meeting with the director or an associate director, followed by a meeting with the staff for an orientation and final review of contract terms. In addition, an independent third-party evaluation may also be requested. For the chemical dependency contract, the physician must submit to random urine drug screens. They must also select and meet with a therapist on a regular basis and a work monitor that sees the physician on a regular basis. The physician must also attend support group meetings on a frequency established by Physician Health Services. The second contract is the Behavioral Health Contract and differs slightly from the Chemical Dependency Contract. In the Behavioral Health Contract, the physician must select and meet with a therapist on a weekly basis for the first 6 months, and then on a schedule as determined by the therapist. They must have a work monitor that sees the physician on a regular basis and must attend a monthly physician support group meeting. There are also specific monitoring guidelines listed on each contract that are tailored to the behavioral or mental health issues of each physician. For both contracts, the physician must have a primary care physician and must have had a recent physical examination. We found this to be very important and have noticed that many physicians who come to us seem to have been their own worst doctor. All therapists and monitors that are listed on the contract must submit to us on a quarterly basis a written report attesting to the physician's compliance with the contract. Both of these contracts are designed to aid and guide in the recovery of physicians and provide protection to patients by ensuring the safe practice of medicine.
But my role is really to help doctors get better. Medicine is really the last thing to go. Every doctor thinks that he or she is the best physician on earth, and that despite all the things that are cascading and crunching down in their lives, that they're still doing great medicine. When they start to lose things, when the marriages go, when the relationships go, when they're suddenly confronted with the fact that their behavior is not normal, when they're confronted with a potential loss of their stature, of their privilege to be a doctor, people hit hard.
Physician Health Services was designed by physicians to help physicians. By working with PHS, many physicians are able to continue an active medical practice, while others, after a hiatus, are able to return to work.
This is a disease that touches all of us, directly or indirectly. Groups like the Physicians Health Services in our state help provide that window of opportunity that allows those affected with these particular problems and their families to have a meaningful chance at recovery. For me and for my family, it's made all the difference in the world.
Rates of recovery from addiction for physicians are actually higher than most other occupations. PHS alone has a very favorable success rate of 80% for a 2-year period of sobriety for physicians who have been monitored for psychoactive substance use disorder. There's more to addiction than just statistics. We have heard from those who have experienced personal and professional turmoil, yet have managed to prevail in both areas through the help of PHS. But the statistics can teach us something very important. If you or a colleague require professional intervention, treatment, or simply collegial support concerning these issues, contact Physician Health Services. There is help, and it works.
I had been at work, and I came home that afternoon, and I saw a motorcycle officer at the end of our driveway. And my husband's car was there, but he was sitting in the car. The police officer said to me, "Do you live here?" I said, "Yes, I do." And he said, "Well, I just followed your husband home from the liquor store. The owner had called and said this man seems to be under the influence, and he was trying to buy liquor from me, but I wouldn't sell it to him. And my elderly neighbor had been outside in the yard too. She said, you know, your boy was crying. I went out to see what was wrong. He was all alone in the yard. She told me when your husband pulled in the driveway, he almost hit him with the car on the way in. So I knew then I couldn't trust him with anything at home. He was just dangerous to all of us. Now that there's so much more support out there through physician health services, all the groups that are available to people, I would say, you know, anyone who has a problem with drugs, alcohol, to reach out to these groups is a wonderful thing. We're really rather grateful that we've grown through it all, and we're actually humbled, I guess, by, you know, what we've been through and how far we've come.